My name is Amelia Henning, and I'm a midwife and lactation consultant here at Massachusetts General Hospital. I've worked as a midwife here since 2004. Breastfeeding and the field of lactation have always been a clinical love of mine, so I am excited to lead the lactation program here at Mass General. As a midwife and a certified lactation consultant, I support families through pregnancy and into the postpartum, which is sometimes called the fourth trimester. One of the most important aspects of midwifery care is recognition of the normalcy of a woman's reproductive cycle. We acknowledge the physiologic normalcy of pregnancy, birth, and lactation, and the importance of education around these processes. So my goal is to help families to safely navigate pregnancy, labor, birth, and the postpartum with confidence and understanding. One of the ways I do this is through encouraging clients to ask questions and to get the support they need in every trimester. What is the fourth trimester? Well, you are probably familiar with the 3 trimesters of pregnancy, but then the baby arrives. And what's that? This is what we call the fourth trimester. For many families, it is in this time that many new challenges begin. Whether it's breastfeeding, lack of sleep, changes in your body, new family dynamics, or medical issues. We want you to feel supported all through your pregnancy and after delivery. Breastfeeding seems like it should be easy and natural, but sometimes it is not. We want to support new families and help them realize their breastfeeding goals and make this transition into parenthood as smooth as possible. I want to note here that sometimes I use the term breastfeeding and sometimes lactation, and many times they are interchangeable. The most important message is that your milk is a vital part of your and your baby's health, no matter how your baby gets that milk. We will start talking to you about how you will feed your baby early in your prenatal care, often in the first trimester. Many couples have an idea about how they would like to feed their baby long before they get pregnant. These ideas come from how your mother fed you, your family culture, maybe from what you've seen and heard from your sisters, aunts, or grandmothers, as well as friends and other sources. Many people are also influenced by what society and the media say about how we should or shouldn't feed our babies. We want to give you the most information we can to help you make an informed decision that will work best for you and your family. Did you know that breast milk is a living tissue with cells and other components to promote growth and immunity in your child? Breast milk is one of the most dynamic and powerful human tissues. Babies who are breastfed are healthier, both while they are breastfeeding and later in life. They have lower rates of ear and lung infections, diarrhea, asthma, even obesity and leukemia. And this is just to name a few. Breast milk also has an amazing property to adapt to the changing needs of the baby. If you compare the breast milk of a mom making milk for a newborn to the milk of that same mom when her baby is older, you will find that the composition is different at different ages. And this just happens naturally. Breast milk is extremely important for premature babies. It protects the intestines of these very young, fragile babies against a disease called necrotizing enterocolitis. This disease can have very devastating effects on sick premature babies. Often, if mom is not able to make enough of her own milk, we will even recommend using banked or donor milk to help protect from this complication of prematurity. In addition to all of these benefits, babies who are breastfed are less likely to die of SIDS than babies who are fed formula. SIDS is the acronym for Sudden Infant Death Syndrome. This is a complex diagnosis, but there are a couple aspects of SIDS that are clear. We know that babies who receive breast milk are more protected from this tragic outcome. Lying babies on their backs on a firm sleep surface that is free of pillows, blankets, and toys also is protective of SIDS, as is a smoke-free home. And what about the mom who provides breast milk? How does it affect her? In the past, our focus was on how breastfeeding benefits babies, but we now know that breastfeeding also protects women from some very serious diseases as well. For example, women who breastfeed are less likely to have type 2 diabetes, certain types of breast cancer, and ovarian cancer. In addition, they have better cardiovascular health. Breastfeeding burns calories, and many women return to the pre-pregnancy weight earlier when they breastfeed. It helps decrease the bleeding right after the birth of the baby as well. And finally, breastfeeding promotes bonding and feelings of well-being with you and your new baby. What is breastfeeding medicine? Breastfeeding medicine is a specialty that uses evidence-based information to promote, protect, and support breastfeeding and human lactation. It delves into the complexity of breastfeeding and lactation, focusing on what we call the breastfeeding dyad, the mother and the baby. Here at the Massachusetts General Hospital, we are pleased to have a clinic devoted to addressing the complications that can arise in breastfeeding and lactation. A consultation in our lactation clinic involves taking a thorough history and usually an examination of both mother and baby. Observation of the baby breastfeeding or the mother pumping is often an important part of the visit, but not always. For example, sometimes the baby is hospitalized and cannot be present for an appointment. Or maybe the problem is related only to the woman or only to the baby. The breastfeeding medicine specialist is prepared to work with the woman and the baby to improve breastfeeding complications or problems. So why might someone need to see a breastfeeding medicine specialist? The most common reason why mothers and babies come to see me are persistent pain during or after breastfeeding or pumping, recurrent infections of the breast or complications from these infections, and low milk supply. Sometimes women make too much milk, and this can also be problematic. Some babies have abnormalities of their mouth, lip, or tongue, which make breastfeeding more difficult. Some mothers have other medical problems or take medications, which may make breastfeeding challenging as well. Women may stop breastfeeding abruptly due to an illness, then wish to restart again. Or perhaps they are adopting a child or using a gestational carrier and would like to breastfeed or provide breast milk for their infant. These are just some examples of why families seek the care of a breastfeeding specialist. Did you know that we have a milk bank here just outside of Boston? It's called the Mother's Milk Bank of New England. Donating milk is similar to donating blood. Women who donate are screened with a very thorough questionnaire. Then they have blood tests just like at the blood donation centers. Milk is collected, then it is heat treated or pasteurized. This process decreases bacterial counts while still maintaining many of the living cells and antibodies that are needed to protect babies. Donor milk has become the standard of care in many neonatal intensive care units in our country and around the world. Here at MGH, we hope to help you get breastfeeding off to the best start. We are a baby-friendly designated hospital, which means we have fully implemented the 10 steps to successful breastfeeding put forth by the World Health Organization. We achieved this goal in 2015, and we work to maintain it by doing special projects each year. We will teach you about the 10 steps throughout your pregnancy, so you are ready when it's time to have your baby. Please know that we are here to help, and we know that not all families are the same. We are fully prepared to support your needs however they may look. The best thing about the Baby-Friendly Initiative is that all of our staff have gotten more breastfeeding education for this process, so we are all better prepared to help you. Our nurses, midwives, doctors, and other staff have all received special training to help support your goals. We have a lactation staff to help support you while you are here in the hospital. And if you choose not to breastfeed, we will help you learn how to prepare GIVE formula in a safe and effective way. Many of the 10 steps are beneficial for families regardless of how you decide to feed your baby. Once you leave the hospital, it can be very helpful to participate in a support group. Here at MGH, we run a weekly drop-in group for support in the 4th trimester, and the milk group, that's Mother Infant Feeding Club, meets at the MGH Revere Health Center. Another great option is facilitated by our staff and the staff of the MGH Institute of Health Professions. Many of these groups are meeting virtually due to the pandemic, and despite the limitations of video, families find that this support is very helpful. You can find out more information about all of these groups on our department website. A calendar of breastfeeding support groups in the city of Boston and the surrounding towns is maintained with updated listings online by Vital Village. Finally, a helpful resource for lactation support after leaving the hospital is called Zip Milk. This is a website that will help you find all the breastfeeding resources in your own community based on your zip code. For more information on that, please go to www.zipmilk.org. Thanks for listening. I hope you enjoyed learning about our lactation program here at Mass General Hospital. If you're interested in a consultation in the breastfeeding clinic, You can call the OB office at 617-724-2229 to schedule an appointment during your pregnancy or after you have had your baby. We hope you and your family find all the information and support that you need to meet your goals for feeding your baby.